Hi. Meet Peppa. He loves to eat and sleep all day. Then one day suddenly he fell very sick and went to see a doctor. The doctor told him that he has deep vein thrombosis. So, what is actually deep vein thrombosis? Deep vein thrombosis is also very common in humans and generally occurs in individuals with a sedentary lifestyle. In deep vein thrombosis, or DVT, blood clots forms in the deep veins, typically in the lower leg. Due to this, the affected veins get narrower over time, and leg pain and swelling will occur. One of the treatments for DVT is histotripsy, which doesn't require any invasive surgery and uses focused ultrasound waves to break up harmful blood clots inside our body. In histotripsy therapy, an ultrasound transducer is used with water as a coupling medium. Then ultrasound waves are generated and focused in a particular area, in this case, that would be the deep veins in the leg, to break up the clotted blood with the help of ultrasound pressure. The idea is very similar to using sound as a super-precise jackhammer for shattering clots into tiny pieces so the body can naturally clear them out. But there are some complexities when we want to focus ultrasound waves in a heterogeneous medium. For example, when we are focusing ultrasound waves in a homogeneous medium like water, there is no aberration, and the sound waves can travel and be focused very easily on a particular point. The primary reason behind that is the uniform density and speed of sound in water. But when we want to focus sound waves in a heterogeneous medium, in this case, consider a block of muscle that consists of skin, fat, and connective tissue, the sound waves become aberrated in the different layers and lose their focus. The primary reason behind that is the different tissue layers in our body have different densities and affects the speed of sound differently, which impacts the traveling pathway of sound waves. For this reason, focusing sound waves inside our body becomes much more difficult. In the Biomedical Ultrasonics and Cavitation Laboratory at the University of Cincinnati, Dr. Kevin Hayworth and his PhD student, Iftekhar, are working on computational modeling of ultrasound waves and evaluating different aberration correction algorithms for histotripsy therapy of deep vein thrombosis. They believe that the aberration of sound waves in different tissue layers can be controlled to a significant extent if they can optimize the existing aberration correction algorithms. The ultimate goal of this project is to develop and optimize an aberration correction algorithm and integrate it into the histotripsy therapeutic process so that the treatment of deep vein thrombosis can be more precise and efficient. Come join us and work with us in a highly collaborative research environment.